Welcome to the Business Growth Spotlight, where we shine the light and we talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses scale and grow using outside-the-box visibility and automation strategies. If you're new to the podcast, welcome. We're excited to have you here. You're in for a real treat. And also stay to the end because I have a special gift for you. So without further ado, I'd like to introduce you to my guest today. He's pretty awesome. His name is Iqbal Shariff with Best Home Healthcare Network. So welcome, Iqbal, to the show.
Thank you so much, Heidi. Excited as well.
I'm excited to have you here. So Iqbal, can you share with us a little bit about yourself, about Best Home Healthcare Network, and your role within the company?
Absolutely. So my name is Iqbal Shariff. I'm the CEO of Best Home Healthcare Network. Best Home Healthcare Network was actually started in 2006. 2009, it was CHAPS and Medicare certified. And CHAPS, if you're not aware of, is a community health accreditation program. It's a higher deemed valued organization according to Medicare. In 2012, I purchased the company, and I'm the CEO of the company.
Fantastic. So what inspired you to purchase it, and what problem were you determined to solve?
No, great question. A lot of it has to do with me growing up. I always wanted to be someone that's an innovator, someone that creates solutions for people and really help people. My mom's a physician, and seeing her wake up early in the morning to go to a public safety net hospital in Cook County, in Chicago, early in the morning, inspired by the construction workers and telling me every morning, like, you got to wake up every day, and help people, and she never took a day off because people would take the bus and the train to get to see her. And it's just, to me, I see that I see what she does. I'm like, I need to be in healthcare. I want to help people. And I see my dad, who's on the admin side of things. And he actually told me that, hey, if you really want to make a difference, you may want to consider home health care. And I see that it's going to be growing in the next 3-4 years. And I think there's an opportunity to do something different and innovate. So I thank my mom and my dad for putting me in a position and helping me make that decision. So that's how I came to the 2012. Yeah.
But it's really beautiful that your parents were such a great inspiration to you. So thank you for sharing your journey with us. So Iqbal, what makes high quality home healthcare different from the more traditional healthcare experience that people are used to?
Yeah, absolutely. So what makes high quality of care different from the traditional healthcare that people get? That's a great question. When you're at home, it's a different experience. Patients, they're doing their job. They could be a librarian, they could be a construction worker, they could be behind the desk. Doesn't matter what their job is. And all of a sudden, something happens in their life that changes. Something in their life that happens that changes. They suffer a heart attack, a stroke, or they have knee problems, and they have to go to the hospital. And when they're in the hospital, especially if they have some sort of cardiac condition, they walk out of there from 0 pills to 20 pills, especially if you're some sort of cardiac patient. And that's a complete lifestyle change. It's a complete lifestyle shift for many of the people. Now, that's when our clinicians come in. Patients, let's take, for example, I'm going to use a Chicago favorite, Mama Winslow. Mama Winslow's from Family Matters. If you're familiar with it, might be showcasing my age a little bit. But Mama Winslow, suppose she's doing what she does, suffers a stroke, goes in the hospital. Now, people have many different care pathways, but most people like to go home. They want to go home after the hospital, and so they go home. Our clinicians will go to the patient's home, will go to Mama Winslow's home. And suppose Mom Winslow had a heart attack and she comes out with instructions for us to provide cardiac care. So the primary care physician will talk to us, tell us this is what the game plan is. Our nurses will go out there. Our therapists will go out there based on the physician order. And first thing we'll do is do a home inspection. We'll evaluate the environment, do a head-to-toe assessment, look in the kitchen cabinets. Mama Winslow, in this case, probably has a high salt diet. So in this cardiac condition, our nurse will say, hey, listen, you need to reduce this, and they'll help begin teaching the medications. And so what at the heart of all this is that people want to be comfortable with their healing process. And there's nothing more comfortable than being at home. And at Best Health Network, our clinicians are trained to help you heal in the comfort of your own home, in the environment that you're used to. Because when you're in a hospital, you're not in your environment, you're in someone else's environment. And you have to wake up at 3 in the morning, or some people have to wake up in the morning, get their labs drawn. It's a tough position to be in. But when you're at home, you could do that at the comfort of your own home and recover at your own home and get back into what you do best and what you used to be doing.
Yeah, I know for myself and knowing people that have been in the hospital, it's not the most conducive for healing and rest. You're getting woken up at all different hours of the night, and because they need to take your vitals, or you're getting pricked and prodded and things like that. So yeah, I can see how if you're going to heal from anything or recover, or just as we're getting older we need care, being in the home is definitely the best place, and the place I would want to be for sure. When families begin looking for home health care support, Iqbal, what are the biggest mistakes or misunderstandings that they often have?
Great question. Oftentimes what we see is that patients will call in or ask us, what's the difference between home health care and home care? And home care is not home health care. Home health care is a Medicare service that started when Medicare started in 1965. And it's a physician activated service. Home care is not that. Home care is lower skilled. It's day to day. It's to help you do your everyday tasks, activities of daily living. And home health care is physician activated. We're there for a certain amount of time. We're here to help you at the comfort of your own home, get you to where you need to be, so that you could be independent and get through the day. That's what we that's what we see often, is great confusion between home health care and home care. Some people use home care to describe home health care. Some people use home care to describe home care. Sometimes the linguistics can get confusing in our industry, and sometimes the understanding that goes behind the linguistic understanding they've been given is makes other people perceive us as one service and not the other.
Right. Yeah, absolutely. And thank you for clarifying that, because I'm sure a lot of people, you have to do a lot of clarifying for when people call you. So, Iqbal, healthcare is deeply personal. How do you build trust with patients and families during what is often a stressful and emotional time?
Yeah, I think the most stressful and emotional time that we've seen was COVID-19. And when the pandemic came, we planned for it. We did a tabletop emergency planning in late December, and we said, hey, we need to find and purchase as much PPE as possible in case the government shuts down. And we were ahead of that. And when there was a shutdown, our clinicians were outside when we witnessed in the news and in Chicagoland area, and even across the nation, people from skilled nursing facilities and other healthcare settings, including home health care, having shortage of PPEs and finding creative ways to manage and maintain the PPEs. We have a high stock of PPEs back in before the shutdown occurred. Our clinicians were out there. We encountered situations where people were in shock. A family member, the whole families would go in there into the hospital, and one would come out. And so our clinicians had to be very sensitive and had another task they had to perform, which is emotional support. We already provide emotional support, coaching, and encouragement. In COVID-19, it was a little bit more of a new strand of support, and that's to be there, make sure the patient feels safe and feel safe at home, and not to get overwhelmed, and let them see a silver lining and experience the sunshine and feel better. So when it comes to personalized care and in during emotional times and stressful times, our clinicians build that rapport with the patient but our organization also supports that. And that's one of the core tenets of our organization, which is patient safety. Patient safety is preventing preventable medical errors, and part of that is making sure that a patient is feels emotionally safe during a difficult time and feels confidence in themselves and um, and the recovery process.
Amazing. So it sounds like your team is really trained with how to support the families, not only the patient, but also the families, which is really, really important. Question for you as far as like how your business has evolved. You brought up COVID, and I'm sure that, you purchasing the business years ago and running it, and then now moving into this pandemic time, and then moving through the pandemic into now. Can you share with us any of the challenges that you faced that you during over this, ups and downs in this period of, say, 10 years, 10, 12 years? You don't need to go into all of them. But what are some of the most significant challenges that you feel you faced, and how did you overcome them?
Absolutely. So let me go back to our tagline, which is patient safety. And patient safety is preventing preventable medical errors. The IOM in 1990, and this is a tenet that's really inspired us and our organization. Those two words is what defines who we are, how we make our decisions. It's one of the reasons why we made the decision to procure PPEs before the pandemic so that our clinicians are out there when the world was shut down. So patient safety is preventing preventable medical errors. In 1999, the IOM, the Institute of Medicine, came out of a report, and this report was very scary to hear. And they said, and they gave the example, if an airplane were to blow up every day, how trusting would you be with the airline industry? And of course, everyone would say we would not trust the airline industry if an airplane were to explode every day. And then they followed it and they said, that's what happens in healthcare every single day. And that's a very chilling, bone chilling statement to read. And you wonder if that still exists. And we've made such significant progress since then, especially with healthcare reform. But patient safety is a very important part of our organization. And it's really what helped us get through the challenges and help us make clear decisions during difficult moments. And the first moment that we experienced a lot of difficulties was with healthcare reform being passed. And we learned from Boston before 2012, before healthcare reform was passed, and what they've experienced. We did a lot of research in that. And when they had their version of healthcare reform, and in 2012, Illinois was one of the first demonstration states to have Medicaid available to everyone. Now, let's take a moment. This is slightly more than a decade ago. It's important to pause and reflect and see what kind of world we lived in. In 2012, people sat down and looked at their hands, and they finally had an insurance card, a card that says I could get care. Before 2012, it was very difficult for people to get care. That was called charity care. But now they have a card and they could go to the hospital, they could see their primary care physician, they could start taking care of themselves. It's very common now for everyone to have insurance. But before healthcare reform, people didn't have insurance. And what we learned in Boston, what happened in Massachusetts, I should say, is that when people had their cards, ER utilization skyrocketed, which increased the cost. And it takes time for people to get to where they need to realize that, hey, there's urgent cares and you don't need to use that as a primary source of care, because that's all they knew.
Right.
And now things changed since then. And what we experienced during that time is getting phone calls, saying, "Hey, I know that it's a business issue and it's a financial issue, but can you please take care of her? My mom, she's coming out of the hospital, and we're trying to find a home health care agency that could care for her." And at that time, the state of Illinois was paying at labor costs or even below labor costs for Medicaid home healthcare services. And many, if not all organizations were saying no to the care. And the story that we have, that we tell people is, and these are true cases. I just modified the names and consolidated the stories into this story, is Rhonda and Brenda. Rhonda and Brenda, two identical people living in two parts of Chicagoland, and they both suffered a heart attack. And Rhonda goes to an academic center, and Brenda goes to a safety net hospital, community safety net hospital, and in Inglewood. And the other one, they're both in Inglewood. One of them goes to academic center in downtown. Now, Rhonda and gets discharged with home health care, and Brenda gets discharged without home health care. Now, the question is, why was Rhonda, how did Rhonda get access to home health care, but Brenda did not? It's um, because it's a business model decision on home health care agency's part to say yes or no, because they're getting paid at cost rate or below. And so what happened is that there's a lot of bartering under the table with the academic center, with the safety net hospitals and the academic center, because at the academic center, what they'll do is they'll horse trade with the home health care agencies, and they'll say, hey, you know what? I've got one Medicaid patient. Can you take two non-Medicaid patients? And the home health care agencies will say, we'll have all the leverage and say, can you give me one more non-Medicaid patient so I can, and I'll process that home health care referral to you. And so that's how that's how Rhonda got home health care. And even when Rhonda got home health care, it was abbreviated services so that the home health care agencies can balance their pocketbooks. Brenda, on the other hand, would have an abbreviated care at the hospital, and they'll call their Aunt Barbara and say, hey, Aunt Barbara, you need to get here. This is the care plan. I need you to go home and take care of your niece for you, and here's the instructions. And so there's a lot of disparity and inequality in healthcare during that time period. And we would walk in and we'd talk to the health plan and say, hey, this is your problem, and we'd be more than happy to work with you on solving this, and we worked with the health plans in solving this, and we were able to help give access to care to a lot of people during that time period of 2012 to the pandemic. And we were a Medicaid first organization. And we're the first of its kind to be the Medicaid first organization. And that's a difficult challenge for us, but we overcame it because we were able to work with the health plans, show them the value, and tell them, hey, this is what you're going to get when we're here, and walking them through the value that they're receiving when we're involved, help them make us preferred providers for many of the Medicaid plans in our marketplace. So that was a challenge for many of the patients that we helped advocate for. And that's what patient safety is, preventing medical errors. We are able to prevent them from going to the hospital. We will prevent them from being in a higher cost curve with some of the health conditions they might have, whether it's diabetes, hypertension, or other chronic illnesses. We were able to help those health plans give access to great quality clinicians for this patient population. That was the first challenge. The pandemic was another challenge, which I shared with you about, which is in preventing preventable medical errors, how to be proactive. And post-pandemic, we're starting to see, we started to see a shift, a pivot. Now, this pivot is defined by two things. One is that the way the medical industry understands how to care for patients, and there's nothing wrong with it. It's just a lot of science that's behind it, a lot of research that's behind it. It's called, well, let me describe the shift before going into the science. And the shift is that people were, before the pandemic, were playing not to lose. Now patients are playing to win. Now that's a shift that we've seen after the pandemic, during and after the pandemic, is starting to increase. What I mean by that is that by playing not to lose, that's defined by aging in place. Aging in place is making sure that the patient is not getting worse than they actually are, just trying to maintain them and helping them maintain their level, and have a nice, easy declination in some cases, or maintain what they are, where they are, whereas playing to win is a proactive approach. Patients are starting, and our in-home clinicians have identified that patients are starting to ask them questions or seek guidance with regards to how to be proactive with their health care, and how to be more healthy, how to eat healthy, what are some good recipes, what are some ways to think about living longevity, having more life in their days and days in their life. That's something that we're seeing a shift in, and our home health clinicians have identified that our team in the back end office was able to review the data points and and quantify that, and we're just seeing a big trend, and it's up to the health plans and the health care organizations to take advantage of some of the insights that we have, and we can work with them innovatively on.
Well, thank you for sharing all of that and how those are not simple challenges that you've moved through and navigated. So thank you for sharing all the different stages and the challenges that you had in your growth process. And it's amazing to me that they didn't have these cards or healthcare options just 12 years ago. I mean, it was just 12 years ago you're talking about, or 14 years ago when this happened. So as you've grown, how are you and now how are you getting in front of these families? How are they finding you, and knowing that your service is available to them to support their loved ones with home health care?
No, that's a great question. Families and patients find us, and typically when it's not home healthcare is not the first thing that people think about. It's an option that's presented to them when they're at a healthcare organization. So typically, patients find us because a hospital present with them options, and they get to choose from the list. Another way a patient might find us or a family might find us is that they're at a primary care physician's office and they need help with stabilizing their conditions. That's how they'll find us. Now we're seeing people calling us and saying, "Hey, I need help at home, and what are the steps?" And we tell them, "Hey, we can't offer you that. A primary care physician has to activate those services for you, and there has to be a goal intended, and he has to give us guidance on how we're going to achieve those goals for you." So those are the three ways patients find us. And the way we show value to the healthcare system and the network is by getting in front of executives and health plan leadership and executive boards, and we do that by meeting with them at their locations. We'll be at conferences or meetings, and we'll just bump into each other. We'll have lunch together, and that's when I'm able to rub my elbow against people and say, "Hey, listen, this is a problem that you might be facing, and we'd love to be the person that helps solve them for you, and there's insights we have that you might want to take advantage of that are left on the table that you're not able to utilize to solve some of the challenges and roadblocks you might be facing." So those are the two ways we are able to support the healthcare system and support patients, is both at the hospital when they're at the bedside or at the primary care physician's office. We also help the leadership of healthcare organizations, and so they can access the value that they can access through our in-home healthcare clinicians.
So, Iqbal, a question for you in regards to technology and the future and AI. How are you seeing AI and technology impacting the future of home health care while still maintaining the human connection that patients need?
It offers us a lot of opportunities. There's most of our AI is built into our revenue cycle management and our quality programs that we have here. So, and it's tied into our EMR. So we're thankful we have a great EMR partner, and they have partnered with very intelligent organizations and vetted them and are partnered with them. We use them to make sure that the quality of our care is documented, and documented meaning that assessed, and we have better understanding of what our clinicians are doing. Our clinicians detect narratives, and we utilize technology to do a search of all the narratives for each visit. And they're not, and these are like narratives, I mean, they're documented. So I say that because most organizations, they copy and paste previous notes, and we don't do that. Every visit is unique, documented, and all those insights that come along with it. We utilize AI to help us understand what the key insights and drivers are in helping patients go over from where they are and when they started the care and where they are at the end of the care. So AI is going to be a big part in our ability to demonstrate the value and provide even better quality of care than before, because what was done by humans now done repeatedly with technology, and it's just going to allow us to use our brains and give us more time to use our brains and more to enhance the quality of care for the patient. So we're excited about that. We're seeing things that we couldn't have before AI opportunities came our way, and we love the partners we work with, and it's just we don't just use our partners are not just partners where it's transactional. Every partnership we have, every organization that we work with has to be committed to patient safety and how do we push the boundaries of healthcare together. So that's the kind of organization we are. We always want to push the boundaries of healthcare.
Amazing. So, Iqbal, what's next for you all in the next 12 months? Or if you're so open to share with us, if you have that projection of 5 years, 10 years, what's coming up for you?
Absolutely, great question. The next 6 months, we're happy to make the announcement that we will be having a caregiving service, and I know in the beginning we talked about the nuances between home care and home health care, and people often get confused by that. We've been getting a lot of feedback from the partners that we work with that there's a growing need of home care, and we talk to all of our healthcare partners, PCP offices, and health plans, and they all said, hey, you know what? If you could add value to us and make our day a little bit more easier, it would be in home care. And so we responded to their requests, and we formalized the game plan, and we said, hey, you know what? We're going to launch a home care organization, and that's going to be launched. We're going to go live after July 4th. So
That's
definitely excited about
exciting.
that. Yeah, in the next 6 to 12 months, and in the balance of the decade and into the next decade, we're our organization is very ambitious. We're very opinionated, and we prophesize that we will be able to save the state of Illinois healthcare systems, Medicaid, and all the providers inside the network, very least $100 million.
Wow.
And
That's
our goal,
incredible.
yeah, and our goal is to be able to, we spend roughly 20 cents per dollar in taxes for healthcare. Our organization's goal is to at least give back a penny back into our taxpayer dollars and in the next decade, you know, and help patients, help everyday people, not be in that cost bracket of being in that transactional loop of or that cycle of and we're going to do that by preventing people from being in that cycle of diabetes and other chronic illnesses that are costing healthcare dollars, and things that we are starting to learn from our insights that we'll have more formal data at the end of the year and that are outside of the traditional understanding of what costs a lot of money. Because there are things out there inside the patient's home that we're seeing that's costing a lot of money in the patient's home that and health plans are not aware of, and so that's how we're going to give back and I would estimate it's rough north of $1 billion, that we're going to give back into the pockets of everyday Americans, our nation. These are things that we're going to be doing.
That's amazing and incredible. And I'm excited for that. So congratulations on that. I love your vision. And I know with what everything you've done up to this point, I know that you're gonna make it happen. So I'm excited to be there to celebrate you when it does. Iqbal, can you share with everybody how they can connect with you and reach out to you?
Absolutely. You can go to our website, www.bhhcare.com. You could find me on LinkedIn and our company on LinkedIn, or you could call us at our phone number, which is 312-461-1700. And if you connect with me on LinkedIn, my email address is there. So there's many ways to reach out to us and access us and looking forward to connect with people and helping them solve the problems both at a patient level and at a system-wide level as well.
Absolutely. So make sure that you go to bhhcare.com and go check out the website, Best Home Healthcare Network. So it's bhhcare.com. And we'll have all of Iqbal's social media links and email and all of that and phone number for you in the show notes. So if you missed any of that, don't worry. We got you. If you're watching us on YouTube, thank you. Iqbal and I say hi, and we're glad you're here. Thank you for joining us. If you know of anybody that could benefit from home healthcare services or need to learn more about what's available out there and what it means, right, for their loved ones or your loved ones, then reach out to Iqbal, connect with him, ask him questions. Whether you're in Illinois or not doesn't mean that he can't support you or talk with you. So make sure you go check out the website, make sure you go connect with him, learn more. I know that we all know somebody that can learn more about home health care and what the opportunities are about that out there. Many times we don't know what we don't know, right? So when we have a new ailment or something we're moving through, we have a lot of emotions that are tied up with that are coming up with that. And our families have a lot of emotions many times that they're navigating as well. And what's the next step is reliant upon what we're told from the people we trust in the medical industry. And if they don't share this information with us, we don't know it's available. So what I'm sharing, the reason I say that is please advocate for yourself. Please advocate for your loved ones. Please know that what you're told in the healthcare by the health community doesn't necessarily mean that's the only answer and that's the only support. And it's not because they're sharing that because they don't want you to use other opportunities. It's just they don't know. They may not know. So just please know, advocate for yourself, advocate for your loved ones. Know that there's options out there for you. Home health care could be one of them. Home care could be one of them. Hospitalization could be one of them, whatever it is, but get to know all of your options. That's a long-winded way of saying go check them out. If you're listening to us on your favorite podcast platform, thank you. If you're so inclined to give us 5 stars, we'd love it. The reason why is because it helps the podcast platform, Apple, Spotify, etc., share this episode out with more people once they get the review. And Iqbal is sharing his time with us, and we want to support him by letting people know that he's here and his service is available. And we need everybody's help to do that. So thank you, Iqbal. Is there anything that you'd like to say or share that I didn't get to ask you or we didn't talk about today?
No, I think you hit all the points. I really appreciate you giving the time and the opportunity to speak with me and speak to the audience, and I look forward to hopefully being a part of this in a year or 2 years' time and give you the updates on the goals.
Yeah, we want to bring you back. We want to hear how much money you're saving the state. So that's exciting because then other states can follow, right?
Yeah,
proven plan we can follow.
Another state was actually inquiring about us, and we're actually talking about that right now.
That's exciting. Okay. Well, thank you, Iqbal, for being here today with us. Thank you for listening to us on today on the Business Growth Spotlight. Reach out to him, connect with him, go to the show notes and grab his email address and all the good stuff in social media. And also go to bhhcare.com. Thank you, Iqbal. Thank you all for listening to us today. And I look forward to seeing you on the next episode of the Business Growth Spotlight.